I'm Dr. Cheryl Holder. I'm Executive Director of the Florida Clinicians for Climate Action. Our speaker today is Elizabeth Joseph. Now, Elizabeth is a board-certified nurse practitioner educator who's been in the Jackson Health System 30 years already.
Thank you, Dr. Holder, for that introduction. These are the learning objectives. The ways of climate change affects public health, identifying 3 actions nurses and healthcare workers can take to advocate for climate solution, and we're talking about populations that are more vulnerable to the impact of climate change. This graph, if you look at it, clearly shows that much of Earth's temperature would have risen based only on natural phenomenon versus the increase in the output of greenhouse gases. So global warming refers to the Earth's rising temperature. Climate change includes not only global warming, it refers to both human and natural occurring effects on our planet's climate. So what does greenhouse gas comprise of? I already spoke about carbon dioxide, from the burning of fossil fuel, solid waste, trees and other biological materials and certain chemical reactions like manufacturing cement. All this produce carbon dioxide. The agriculture industry is the number one cause of the methane gases. Nitrous oxide is another type of greenhouse gases. This is emitted during agriculture and industrial activities, combustion of fuel, fossil fuels. Then we have the fluorinated gases as well. So many medical journals, many journals have stated over and over again that tackling climate change could be the greatest global health opportunity of the 21st century. So impact of climate change is huge. This pictogram speaks volumes of the effect of it. Unfortunately, it's the vulnerable population that gets the most affected with all these changes in the climate. Our low-income communities, communities of color, the children. Extreme heat can cause cardiac stresses, which can aggravate previously diagnosed heart diseases or cause first-time chest pains or shortness of breath. The American Heart Association recently published a review of many studies showing that an increase in stroke during hot weather, mental illness, kidney disease, all these an increase. We see this type of things happening all over Florida. Palm Beach County and Henry County emits more pollution from agriculture fires annually than any other U.S. counties. Sugarcane burning, many studies over and over has associated that burning of sugarcanes as the outcome of respiratory disease. In Florida alone, pollen from trees is being released more intensely year after year because of climate change. Thus, it's anticipated that respiratory allergies and asthmas will become more common and severe because of increased exposure to the pollen as a result of climate change. One type of the vector that we have experienced here in Florida is the Aedes mosquito. This mosquito carries the Zika virus, the West Nile virus, and the yellow and dengue fever. I don't know if you probably remember that in 2016, the first recognized outbreak of mosquito-borne transmission of Zika virus happened here in Miami-Dade County. Look how considerably the amount of cases of mosquito-borne diseases has surpassed 1,000 cases or more. And same with the tick-borne diseases, surpassed 200. And this is going to continue if we do not do something about this. So not only extreme heat causes the illnesses, but related to our land, but it's also causing problems with the sea level rises. This diagram depicts that the 10 cities at risk from sea level rises. So if you look at this, Miami is number one. If you see this from the standpoint of the value of the assets at risk, the number one city is Miami, followed by Shanghai in China, New York, and so forth. You can see the cost begins to add up, from train tracks, the airport runaways, and the agriculture industry. All of this is affected. How does climate change affect our food supply? The three most prominent challenges for the crops that the crops face are the heat stresses, the pest, and the disease expanding their ranges. If you look at this, we are seeing the projection of decline significantly in the amounts in the corn, negative 7.4%. In the wheat, the rice, and the soy. These are the four main categories that makes up 2/3 of the calorie intake for all of humanity around the world. The rate of ocean warming has already doubled since 1992 compared with the previous 3 decades. So, what can we as nurses and healthcare workers do? Engage in communicating with their stakeholders, educate our families, educate our colleagues, our patients about the climate impacts and the solutions. Be an advocate. This is one of the organizations that I'm part of. I'm a co-chair for the Practice Forum. This is a great organization if you want to join. These are the ways that you can be empowered by joining organizations such as Alliance of Nurses for Healthy Environment or the FCCA. This is a part of organization that I'm proud of to be associated with. This is a coalition of health professionals and healthcare organizations concerned about the impacts of climate change, and they're doing some great work in Florida. So I want to thank you for your participation in this seminar. I like to end this with this great quote: "We do not inherit the earth from our ancestors; we borrow it from our children."